My name is Robert Lentz. I'm born and raised here in Columbia. On June 5th, my life changed. I had a brain bleed that caused me to have blurry vision. We were so uncertain. We were able to go to Prisma Health and Dr. Moftikar's team, and they said, here's what's taking place. You had a brain bleed, an aneurysm that's kind of burned out, but we found one on the left-hand side. They finally realized that the only way that they can do this is to do brain surgery, go in there and lift the brain up, clip it, take it out, because mine was hard. It had a lot of plaque in it, and that was the route.
Robert came to us with a bleed in the brain, and his case was extremely complex because his bleed was on one side of the brain, and his CAT scan angiogram showed that he has an aneurysm close to the bleed, but it wasn't exactly related to the bleed. Through a lot of complex tests that we do here at Prisma Health, we were trying to figure out exactly what the relationship was, and we finally found out that they are close but maybe unrelated. But nonetheless, the aneurysm that he had to be repaired because of the size and location. With brain aneurysms, there are several ways of fixing them. So first of all, not all of them have to be fixed, but the ones that are in a particular position or location in the brain and a certain size, they need to be fixed. In his case, we talked about the option of an endovascular method where we go through the blood vessel with catheters and wires and try to put coils and stents. It was not a favorable case for that, so he actually had the open brain surgery. We had to open up the brain and then go in and place a clip on the aneurysm, and a clip is basically a small little bobby pin which goes and secures the aneurysm.
After being in the ICU for 2 days, I really didn't know whether I was going to come home or not, but I had faith in the Lord. Secondly, I knew we had the best team, so I didn't worry. Dr. Moftikar and his team, I had my 3 brothers and sisters, my daughter and my son. Every event, he came out and met with them. And he brought his computer and showed them exactly what we were dealing with. So as far as quality of care, I'd give it a 10.
There are 2 kinds of brain aneurysms. Ones that are called ruptured or they bleed. It's called a subarachnoid hemorrhage. And there is a kind called an unruptured aneurysm, which it doesn't bleed. With patients who don't have a bleed and we catch the aneurysm for whatever reason, they could be having headache, maybe incidental finding of the aneurysm, we can repair it and the outcomes are usually very good. On patients who have a ruptured aneurysm or the aneurysm has a subarachnoid hemorrhage, those are a little bit tougher because you're coming in with a bleed actually, so it's a bleeding stroke. 50% of the people, when they have a bleeding stroke, they could die right there. The other 50% who make it to the hospital, we try to help them by immediately stabilizing them, fixing their aneurysm so it doesn't re-rupture again.
The changes that I've gone through, my life stopped on June the 5th. I was out June, July, and August. It didn't look good the first week or 2, but I started building up more and more and more confidence. And now I got my life back. And that was one of the challenges that I gave Dr. Moftikar. I want my life back. And he came through.